Hi, I'm Dr. Janet Pope, or at Janet Bordeaux, reporting at Room Now at #Eular 2024 in beautiful Vienna, Austria. I'd like to talk about glucocorticoids in SLE, and I want to tell you about three things. So I'm going to tell you background, and then I'm going to talk about oral presentation OP0180. So rumor has it in past that when we withdraw glucocorticoids in people with SLE or lupus who are in clinical remission, that many of them flare. And we've all had patients where they're on 4 or 6 milligrams of prednisone, and as we go down, they feel worse, or they actually clinically flare and they go back up to the dose that they were on that we're trying to get them off of. This study was to look at if patients were in clinical and serological remission. So a SLEDI score of 0. So that's no active lupus by complements or double-stranded DNA and no clinical lupus. And they're on low-dose prednisone, less than or equal to 5 milligrams a day, and stable immune suppression. And what they did was they looked at people retrospectively, not randomized, but those who got off glucocorticoids and those who really couldn't get down. And they looked at the rate of flares, and a flare was saying that their lupus disease activity index went up above 0. So it could have been inflammatory arthritis or a low complement double-stranded DNA. And in this study, they had 360 patients who were able to get off their low-dose prednisone, and about a quarter, or 124, who couldn't. And they looked at the flares and the time to flares. And basically, the annual flare rate, if you got off prednisone, was 1.65 per 100 patient years. And it was 8.5 per 100 patient years who stayed on prednisone. So the conclusion was, number one, if you get off prednisone, you don't have more flares. But number two, this study is biased because the people who didn't get off prednisone probably knew that they had to keep it on board or they would flare. And if you tried to insist and you got them changed up a little bit, but not off prednisone, they flared. So the patients probably knew, and maybe the physicians knew. And number three, there is a past randomized controlled trial of low-dose prednisone in lupus. And if you're randomized to a very slow taper versus keeping them fixed at, say, 5 milligrams a day, there is a higher flare rate. So this study is contrary and opposite to the RCT. And I think the take-home message is, if you're trying to taper and the people flare, just put them back on the previous dose. If you're trying to taper and they're not flaring, try to get them off prednisone altogether. So 3 items that will help you when you're treating your patients on low-dose prednisone who are in full remission from their lupus. Please follow us at Room Now and enjoy your day. Thank you.